we have these newer and I think better techniques to offer the patient.
Then for the elbow tendonitis, the golfer's elbow, which is supposed to be the medial side, and the tennis people, which is on the lateral side. So what's more common, depending on the season?
Yes, and actually, even though the most common tennis elbow is on the lateral side, some people will get it on the medial side. And with that golfer's elbow, it's more common on the medial, but then they'll also get it on the lateral side. The other thing is sometimes, and I think we've all had this experience, we bang our elbow and we've hit the funny bone or the crazy bone, and it's like an electric shock or a taser is going up and down the inside of the arm. Well, that's the ulnar nerve, and that's called the cubital tunnel, and that can be injured or irritated either from tendonitis, that's long-standing, or some people have a narrow space there, and it's much like carpal tunnel in the wrist with the median nerve. This is cubital tunnel of the ulnar nerve at the elbow, but it's the same concept of this squeezing of the nerve that's causing numbness, tingling, and pain. And in this situation, it's the pinky and the ring finger that gets it. And I have one more little sequence here to show you. And the standard incision for this used to be 7 centimeters up, 7 centimeters down, so a large incision to actually do the nerve release. But recently, endoscopic techniques are being adapted for this area. And so with a 2-inch incision, that nerve can have a surgical release done, and this video sequence shows that. And this is relatively new, but there are some good results, and I've been offering it to my patients over the last year and been pretty happy with the results in my own group.
So then the recovery is only 3 weeks?
Oh, that's pretty quick. I let people drive that week.
Very fast.
Yeah, no immobilization, so I let them
no
move
cast.
the arm. No cast, just a
dressing.
soft dressing, yeah. Let the wound heal. Yeah, it's been working out great.
That's amazing.
Yeah.
And then they can go back to their golf and tennis within a week?
I try to let them wait a few weeks, but I'm sure not everybody is following directions completely.
Oh,
so.
they've done well.
Yeah, they seem to have been able to go back to their activity in a several-week time as opposed to a couple months.
Now, the people who have hand surgery and also wrist or elbow surgery for this type of sports injury, what age group? All age groups?
Well, again, all age groups. I think it's a little bit more common in the more mature populations. But there are some younger athletes who are very intense about their sport and get into some of these problems as well. But it's generally, either the elite athlete or the weekend warrior type that we see with these problems. And equipment and training makes a difference. Of course, technique makes a difference, but I don't think it's 100% avoidable for everyone to, not get into trouble with one of these conditions.
Now, you had said that if you were going to tell the home audience a take-home message if they have a young middle schooler involved in baseball or softball, what would you tell them to prevent some of this reconstructive surgery that they might need at age 14?
I think there's a lot of pressure to have these children participate very extensively and exclusively in that sport, and there is, I think, a physical toll to that. So I do recommend really limiting certain activities, especially throwing. I think that having a 12-month-a-year type of schedule is very challenging for the growing body. And I think those things, if they can be avoided, would benefit the young participants and keep them healthy and away from surgeons.
And you mean cross-training them, like
cross-training? Yeah, do different sports, use some different muscles. I mean, one can stay in shape, do more core work, do running. The baseball player plays some soccer or lacrosse or runs track or does swimming, as opposed to only doing the baseball and only doing the pitching. That's going to be helpful.
And then for the working adult who likes to participate in various triathlete or other types of massively intense sports, what would you suggest?
Well, I think getting to a level of activity that's sustainable is the key. So going from like 0 to 60, like a car, is challenging. So you know, the people who train and are able to work in the activity on a regular basis and be mindful of that don't seem to get into that much trouble, as opposed to those that go from very little participation to a lot of participation. And that change, not everybody can tolerate.
So do it in moderation, and if there are issues, see a specialist.
Right.
And sometimes our primary care practitioners may not know what is the latest in terms of micro-incisional surgery and microvascular surgery.
Right. Well, there's a lot of people who, you know, take care of these problems. I mean, there are instructors and trainers, and they all have their expertise. Sometimes, for the surgeon, we say it's an anatomical problem. In other words, there's some abnormality in a specific place that, if it doesn't heal or get better by itself, might be something that the surgeon is best equipped to give advice about, in terms of, you know, if there's a relatively safe and limited incision type of surgical treatment, then that might be something worth considering.
Also, to be aware that there are small incision surgery options available. It's
Yes.
not so new that it's not impossible.
Right, and I think increasingly we have better solutions for a lot of these common problems.
Now, if you were going to sum up micro-incisional and microvascular surgery for the home audience, what do you say for the last 5 years? What is it that is very positive that we can think about?
Well, I think avoiding the injuries is great. Sometimes you can't do that, you know. Some things happen, you've fallen down, you have arthritis, something develops in your musculoskeletal system. Then I think it's good to find out what is new and different. I think that using treatments that have somewhat of a track record is important. But then also having some experts who have those skills and treatments available is really a good thing. I know my patients are benefiting from techniques that I'm using now that didn't exist 5 and 10 years ago, and so I think that there is a real upside.
Well, thank you, Dr. Diao, for joining us. And we've really learned a lot about wrist and elbow injuries, and that there is hope for all of us should we ever need to see you if we fall down or do something really bad, like go from 0 to 60 over a weekend. And we'll hope you join us again. Thank you very much.
Gloria, thank you for having me.